Now I'm pleased to introduce Dr. Jean Frazier. Jean is Vice Chair and Director of the Division of Child and Adolescent Psychiatry and a Professor of Psychiatry and Pediatrics at UMass Medical School. She holds the Robert M. and Shirley S. Siff Endowed Chair, which has a focus on autism. Prior to joining UMass, Jean was Director of the Child and Adolescent Neuropsychiatric Research Program and co-director of the Center for Child and Adolescent Development at Cambridge Health Alliance for Harvard Medical School. Jean is interested in neurodevelopmental disorders, including autism, early onset bipolar disorder, and psychosis, and how scientific methodology can be implemented for early identification, intervention, and even prevention. She's a PI on a number of neuroimaging studies and medication trials, and co-directs the UMass Shriver Center Intellectual and Developmental Disabilities Research Center Clinical Core, and she's now engaged in developing the Center for Autism and Neurodevelopmental Disorders at UMass. Jean is a very active member of our consortium and serves on our steering committee. Please welcome Dr. Jean Frazier.
Thank you very much, Dee Dee. It's a real pleasure to be here, and I'd like to extend a warm welcome to Chris McDougall. It's really nice to have him here in Massachusetts. Well, I was in Boston for years, and I made a little journey out to Central Mass, and I'm taking some of the umbrella out there, and I think my talk's a little different than the prior talk in that I really want to focus predominantly on our efforts towards building service delivery out in Central Mass towards Western Massachusetts. Now, the objectives of my talk are really to describe our efforts. We're building something called CAN-DO, and CAN-DO stands for the Center for Autism and Neurodevelopmental Disorders. There are going to be three major components to this new initiative, and I'd like to outline for you why the development of clinical service is really at the heart of our whole initiative. We have an exceptionally strong research team at UMass. We've got the Shriver Center. It is one of the most well-funded organizations in our state, and it's under the UMass umbrella. And then we have the Candy Lab, which is my lab. We are funded through multiple streams, including through NIH. We focused for years on mood dysregulation and are extending that to autism spectrum disorders. But what we really have required is a coalescence of the nuggets of clinical care in central Massachusetts. I will finish up by describing the research efforts, particularly in the Candy Lab, which is my lab, and CAN-DO more broadly. So what are our current challenges? We know they're numerous. I'm highlighting a few for you, but we know that autism, the prevalence of autism is increasing, and certainly the most recent figures indicate that 1 out of 107 children, school-age children in Massachusetts, have autism or an autism spectrum disorder. There's a projection that will continue to increase 25 to 35% in the coming years. So we have a significant number of youths, adolescents, and adults who are affected by spectrum disorders, and they have complex health needs. For example, in a study looking at children with special health care needs with autism spectrum disorders, they found that the special health care needs amongst individuals with autism were more likely to have problems regarding access to care. And also their families had greater financial, employment, and time burdens. Other challenges. There's a severe lack of qualified personnel who have knowledge and experience about autism spectrum disorders and intellectual disabilities. And we know for a fact that there's a graying of our local, state, and national leaders in the ASD and ID fields. There's also a growing gap in the services, unfortunately, for those with ASDs and ID and their families due to budget cuts and lack of qualified personnel. And this comes from the ARC of Massachusetts in 2011. There's also in our state a maldistribution of services. Most of the services reside in Boston, and I applaud all of the efforts in Boston, but we have to have services in central Massachusetts and western Massachusetts where a significant, yes, right? Okay, so that has been the bulk of my, my focus for the last 3 years. Now, I'm still relatively new to UMass. I've been there 3 years. People ask me, why did you want to go to UMass? Why did you leave Harvard and go to UMass? Well, I'll tell you why. Because it's a wonderful place. And people, the dean, the chancellor, my chair, kept wooing me, and I kept saying, I don't want to move. I like Boston. And in fact, I didn't move my home for 3 years, but I went to UMass. And I've come to know the community just enormously. It's a great place. There are good things happening there, clinically and also research-wise. And in fact, I'm so enamored of it that my family moved to central Massachusetts in July. Now, we have to meet these challenges head on. I know that UMass is uniquely poised to establish a program that is beyond compare, to serve individuals on the autism spectrum and those with neurodevelopmental disorders. We have a big catchment area to serve. And then we have the Eureka Bill, the Autism Insurance Law, which is going to facilitate more and more our ability to provide the kind of care that these individuals require. Also on the research side, there's increased funding available for autism research, which makes things very exciting and dynamic. Now, Dr. Bill McIlvain is not here today. He is my co-conspirator, if you will. He is the director of the Shriver Center. He's well-established, well-liked, very smart, and a great buddy to work with. Unfortunately, he's in Brazil. Well, unfortunately for us, not for him. Now, we've really put a lot of work towards this, and I can say very proudly and excitedly that we're officially launching this. Officially, after 3 years of hard work. We have a mission statement. We are launching a capital campaign. And this is our mission statement. I won't bore you with reading it, but basically it says we are committed and we want to deploy the best health care possible for individuals on the spectrum. What will the activities of the center be? Well, first and foremost, we are going to be patient and family-centered, and we're going to provide the best clinical care possible and engage the community in our efforts. It's going to be a center for training and mentorship to provide future providers. And we're going to invest in our future through our research. So as you can see, this is our little stool, the can-do stool. And there are 3 components to it: training, research, and service. Can-do is already providing clinical care across the lifespan. You know, we've been kind of a diamond in the rough because people tend to think about Boston, but services have been in existence in Central Mass for years. We actually have an extremely strong adult ID team, and we have the beginnings of a really tight-knit child program and have started transition-age youth consultations. We have care coordination in the form of our McPAP service. I'm the medical director of McPAP. That's the Massachusetts Child and Adolescent Psychiatry Access Program that provides phone consultation, but they also are providing an enormous amount of care coordination. Inherently, this is going to be a multidisciplinary effort. It already is. It's patient-centered. Ultimately, 4 years down the line, we are going to have a state-of-the-art facility in which clinical care and research, bench to clinical practice across the lifespan will be occurring. Our current can-do team. So we're collaborating on all levels, and I really mean that. Providing care for individuals with multi-complex troubles involves collaboration and communication, the 2 big C's. And we started with a collaborative effort. When I came to UMass in October 2008, I started immediately meeting with all of the key players in the UMass community. The driving forces at this point behind our efforts include the dean, the chancellor of UMass, John O'Brien, the president of the hospital, and we have a memorandum of understanding which, no lie, took me 3 months to get all of the signatures in place. All of the players in the UMass community who have anything to do with autism spectrum disorders signed that memorandum of understanding, including the head of internal medicine, head of family practice, head of pediatrics, head of psychiatry, the dean, the head of the hospital system, head of Commonwealth medicine. So multiple disciplines are involved and committed. Families are involved and committed. We have an advisory board. I asked people, initially 26 people, if they would serve on the advisory board. These are parents, these are clients, these are representatives of service agencies, and all 26 said yes. And our advisory board has expanded now to 30 members. Providers are engaged. We're very involved with UMass is a primary care medical school, as you all know. It was founded for that purpose. So we interface very tightly with the family practitioners and pediatricians in the community. So we have a 4 to 5 year strategic plan. There's both the operating component of it and the development component. I thank the development office for helping facilitate that. I see John Hayes in the audience here. John, if you can. But we basically have 4 goals, and they one is to really create the facility, the state-of-the-art facility. The second is to implement exemplary evidence-based care. Third, to implement training and mentorship. And the fourth is to carry our research forward. So what actions have we taken today? Because that's the most important and palpable thing. Everybody wants to know, what are you doing right now? Well, first and foremost, we have that memorandum. I was going to bring it here and hold it up for you. To me, that represents everything. It's a commitment. We have initiated a child diagnostic clinic in Biotech 1. For those of you who don't know UMass, first of all, I would invite you to come to visit us. Really is an amazing place. And you'd be very impressed with what's going on out there. But Biotech 1 consists of all of the pediatricians on the university campus. And it's in a circle. All the specialty groups, primary care providers, they're all on Biotech 1. So our child mental health team, the pediatric-focused child mental health team, now has 3 offices on that floor. And we're seeing specifically children on the autism spectrum. The adult ID team, they've been in existence for years, but we just got 5 FTEs committed to the adult ID team in the aftermath of closing our med psych unit for individuals on the spectrum and adults with ID issues. So we closed the inpatient unit. Now it's predominantly an outpatient team, and it is multidisciplinary in nature. They're providing multidisciplinary consultations throughout the state, in Connecticut and some in Vermont. And they've actually just recently been funded to launch a medical home in Worcester County. Finally, the adult ID team and the pediatric team are partnering to do transition-age youth collaborations, including consultations, but also some ongoing care. We also have integrated efforts with the early childhood clinic. There's a lot of crosstalk between the ECC and the mental health team, and we've made several grant applications in conjunction, the Candy team and the Shriver team jointly, and we're eager to hear the results of those applications. Finally, we have pockets of care throughout the university campus, and it's critical so that the care coalesces that we're under the same roof. So in the short run, before we finally have our state-of-the-art facility, we are going to co-locate the adult ID team, the pediatric team, our McPAC services, and our child and family forensic services. And that's currently underway, and we hope that that happens sometime by January or February. We have a number of services. I won't read this list for you, but we do provide care in central Massachusetts for individuals on the spectrum. And we hope ultimately that all of these services are under one roof and can do 4 to 5 years down the line. Now we have this amazing adult team, and Lori Charlotte heads our adult team, and Bob Baldor, who's a family practitioner, is also involved. And finally, I want to wrap up with a few notes. My lab, the Candy Lab, is well funded through the NIH. We do a lot of work looking at affective dysregulation, and we're extending that to autism spectrum disorders. I did mention the Shriver Center. Everybody knows the Shriver Center. Well established. They're part of the LEND, the USAID. They're doing amazing work in terms of advocacy. In fact, it's in large part due to their efforts that the Eureka Bill passed. The nice thing is, they're not just in Waltham, and we're not just in Worcester. We have really co-located. My lab has office space at the Shriver Center. We are a presence. They are using lab space out our way in Worcester to evaluate patients. And hopefully one day we'll all be under the same roof all the time. Now these are some of the research efforts that are going on in my lab specifically. One thing I do want to highlight is we have funding to actually investigate a work model experience for transition age youth with Asperger's syndrome. We got pilot funding through UMass and have just made application for an R34 through NIMH to continue that effort. Our site also was recently identified to participate in some of these novel intervention studies, including erbaclofen. But the Fraxa Foundation has approached us to be the northeastern, or one of the northeastern sites for the future Fragile X intervention studies. We also are engaged in imaging, and we're working, doing ongoing genetics work, but we were involved intimately in the Autism Consortium effort, and we're part of the Shriver Center IDDRC. Now with that, this is just a tip of the iceberg. There's so much going on. There's so much enthusiasm, and we are really looking forward to carrying the ball forward. We're looking forward to collaborating throughout the state of Massachusetts, beyond just Boston, and continuing our collaborations, hopefully with the Lurie Marks Center and others in the Boston area. But for those of you who are from Central Massachusetts, particularly if you want any more information about our Can Do initiative, please contact Laura Myers. For those of you who are in Central Massachusetts or Western Massachusetts particularly, we've got some really cool research studies going on, and this is our contact information. And with that, I'd like to thank you for your attention.